I was always intrigued by brain, but I'm also a musician, I'm a violinist, and so ultimately otology and neurotology combines both. It combines the hearing restoration aspect as well as the part of the brain surgeries where I get to operate on tumors within the skull base of the brain. Majority of the people that come to my practice are people with hearing loss, people that have ringing in the ears, dizziness, and ultimately a lot of the surgical part of that practice involves hearing restoration. My goal is, one is to get to know the patient. I really like taking my time with each patient that I see. I just want to know, for one, is what is the main goal that they came to see me. Second is I want to do a thorough physical examination and make sure that before they leave, I provide them with the diagnosis, or at least various options that potentially they might have. I give them kind of a plan moving forward, whether it's additional tests or labs that we need to do, or even sort of schedule for surgery. But at least I always make sure that before the patient walks out of the room, that they have a plan, that they don't question what's going to be next step, that there is a clear plan moving forward. Most rewarding is positive outcomes. I think as long as the patient either walked out with knowing what they have and they feel confident with their diagnosis, or post-surgical positive outcome, that's what I live for, basically. Just happy patients, happy life. It drives me every day to do what I do, is knowing that they walk into me, sometimes they don't even, are not even able to understand me speaking because they have not yet learned to read lips. So I have to type everything out that I'm speaking as they're speaking back to me. So knowing that degree of hearing loss where they're unable to hear at all, to being able to then hear after surgery and slowly with rehabilitation, if it's a cochlear implant, get the chance to hear again in the near future is very rewarding.